Hey everybody, good morning, good afternoon from wherever you might be joining us for the February 2020 edition of FISMA Fridays. We are excited to have you here today. I think in the long 6+ year history of this, this might be not only one of the most important ones, but one of the largest ones we've ever had for a lot of obvious reasons here. So we are glad you're here, and it's an important day, and we're going to make the best use of the short time we have together, but we appreciate all of you carving some time out of your very busy days. But we're going to get right after it here. For those of you that are new to FSMA Fridays, we want to welcome you. This has been over 6 years now. We've been putting on this as an industry update, longest standing one in the industry. Really started mostly around FSMA related news and regulatory changes and updates as things were being rolled out. And as that's tapered off, we've really kind of transitioned to talk a little bit more about strategy and trends and technology, best practices on a variety of topics around food safety and quality. But one of the best pieces, obviously, is the opportunity to not only hear and learn from our partners at the Atchison Group, but also engage with them on a Q&A, which we look to make time for. So we hope you'll keep coming back, and we really try and make these for you and as valuable as possible in our short time together. So as I mentioned, our partner here is the Atchison Group. Been with us since day one and bringing the FSMA Fridays to our community. We really feel like this is something important to do. I think today's a great example of that, but we're certainly grateful for their partnership, not just for the great content that their experts bring each and every month, but for the great work they do with our customers and many others throughout the food and beverage manufacturing world. So with that, kind of an idea on how we'll tackle the day. So, we try, this is going to be a little bit of a different format in the sense that we're going to share a presentation today that's been prepared with as much great detail for you as possible. We will field questions. We know they're already coming in, and we'll do our best to get to some of those at the end. The way we'll handle the Q&A is we'll monitor those, touch on as many as we can at the end, but we'll also look to take those offline. And there's also some resources that the Atchison Group's already put together that I think you'll find helpful that we'll share as well. So lots of good content to come, but we'll make sure there's a way to get it in your hands as well as quickly as possible. And yes, we will be recording, so you can share this link and the associated resources with that. If you have any audio issues, there's a little chat box. You can chat with our team behind the scenes. Usually there's, if you swap out, if you called in, try your web audio or vice versa. But we'll do our best with any technical issues on the backside. We do have a full house today, hundreds of people registered for this, one of our largest ones ever. So we'll do our best to help everybody if you have any challenges there on the technology side. So again, we're going to touch really quickly on a FSMA update. We're going to dive right into the important stuff here and talking around the coronavirus and what that means for all of you, and get to the Q&A. So with that, I'm going to bring in the more important person of the day, Dr. Ben Miller. He's the Senior Director of Food Safety over at the Atchison Group, has over 20 years of industry experience on the public side with food regulation, food safety management. He was also the Division Director of Food and Feed Safety at the Minnesota Department of Agriculture, and probably just as important or more, he's an epidemiologist at the Minnesota Department of Health. So we have the right person in the room, and he's put together a lot of really great content on short notice for us. So Dr. Miller, welcome. Great to have you back. Thanks for being here.
Thank you, Brian. And thanks to everybody that's joined the call here today. I will be covering an obviously timely and very relevant topic, and we're happy to be able to put out some hopefully useful information for the food industry on COVID-19 as the situation continues to evolve. As far as just a FSMA update, we'll keep it very brief. I just wanted to mention that the third portion of the intentional adulteration guidance is now out. You've probably seen that from FDA if you follow those notifications, but that's now out as part of guidance for the intentional adulteration rule portion of FSMA. So if you haven't seen that, you can certainly Google that, go to FDA's guidance page and find it there. But I can move on to the topic at hand, which is going to be an update on COVID-19. And specifically, how can we start to think about preparing for that from a food industry segment? So, as Brian mentioned, I started my career in public health as an epidemiologist back at the Minnesota Department of Health. It was actually right after 2001, and bioterrorism was in the air, and so I really come from a public health preparedness background and worked on these topics like the SARS outbreak and West Nile as that started to move through the United States. So definitely have been on the front lines of similar situations. I think this one's unique in that it's perhaps going to be more significant than any of the ones that we've seen before, and we'll talk about that. But we'll need to balance, I think, preparedness with pragmatism as we think about how we look at the information and how information evolves over the coming days and weeks, both in the US and also globally. So we have seen previous coronavirus outbreaks, and we'll cover this fairly quickly because if you've been following the news, you probably have a fairly good handle on this. But if you remember, SARS occurred back in 2003. And then we had MERS, which is in 2012. We were able to contain SARS, so it effectively no longer exists. MERS still circulates in small portions of the world, but relatively contained. This new coronavirus started probably somewhere in the fall of last year in China, and we call it a novel coronavirus because it's new. It's new to humans and the ability to cause illness in humans. And just as background, coronaviruses are found both in humans and animals. And so sometimes we call those zoonotic diseases. They can pass between animals and to humans. And that's likely what happened in this case, probably from bats to humans in China. It causes respiratory illness and fever. Those are the primary symptoms. So you look for fever, and a cough essentially is the main symptoms, shortness of breath of COVID-19. And CDC has some really good resources, the Center for Disease Control, in terms of what those specific symptoms are. And I think as Brian mentioned, and we'll mention this multiple times during the call too, is we have set up a resource page on our website where we're going to be sharing a lot of this information and keeping it up to date almost on a daily basis as the situation changes and evolves here in the United States. So transmission primarily occurs through human-to-human contact, through respiratory droplets. It's transmitted very much like influenza is transmitted. So we know a lot about how flu spreads, and we're using the information and knowledge that we have about flu to make some inferences right now about transmission as it relates to COVID-19. I think we saw coronavirus start in China, and so there was initially some association with people from China, and now that we've seen it spread worldwide, I think people are understanding obviously that the virus itself doesn't discriminate between any specific race or ethnicity. No race or ethnicity is more or less likely to become infected. This treats all of us the same in terms of infectivity, at least as adults. There is some evidence that children actually have a lower infection rate. So there is some good news, I think, about what we're learning about the epidemiology of the virus right now, is that it seems to affect children far less or have much milder symptoms than adults. So again, we'll just briefly touch on, what do those symptoms look like? They are flu-like symptoms, but it's important to differentiate. It's not influenza. So some of the less severe symptoms include fever, cough, runny nose, and shortness of breath. Some of the more severe symptoms, and that's where we're seeing a calculated percentage of people that do get the infection. About 80% have a mild illness, and about 20% of those then go on to develop some more severe symptoms, which include more acute respiratory infections, pneumonia, some kidney function failure, diarrhea, and obviously one of the most concerning outcomes of this virus is the mortality rate. We're looking at a mortality rate of somewhere around 2%, which is not doesn't sound high in terms of the overall percentage, but when you compare that to the seasonal flu, you have a mortality rate of around 0.1%. So we're significantly higher than that, at least based on the epidemiology that we currently have. And so that's one of the primary concerns with this virus as it spreads, is even though we have a fairly low percentage mortality rate, that could have a significant impact on the public health system as well as the supply chain. One of the tricky parts about the epidemiology of this virus as well is that the incubation period, the time between exposure and when you might see an onset of symptoms, is anywhere between 2 to 14 days based on what we understand right now. And there's fairly good evidence that people can shed the virus prior to becoming ill, or some people may be asymptomatic altogether and that they don't actually experience any illness, but they can still spread the virus. That's something that's made this much harder to contain than something like SARS, where in the case of SARS, you had to become pretty sick and progress fairly far in your illness before you were infective to others. So when I put this slide together last week, I just put a question mark here because I think at that time we were at 13 confirmed cases in the US. We're up to 60 confirmed cases now. I think the general consensus is that that number is probably significantly higher than that, just due to the fact that we don't have a lot of testing capability currently. This slide is also inaccurate as of 2 days ago, in the sense that transmission, where it says transmission is not within communities, we have some evidence of community transmission in California, based on a case in California from 2 days ago. We are probably likely to see further evidence of community transmission over the coming days and weeks here in the United States. And obviously that just creates much more importance in terms of understanding both the epidemiology of this virus, but also from a food industry perspective, what can we do to be prepared when we might see transmission in the community where our restaurants or food manufacturing facilities are located. So survivability on surfaces, this has also become somewhat of a concern in terms of the risk of what we would call fomite transmission. So fomites are surfaces, essentially, in epidemiologic speak. So if somebody coughs on a table or coughs on a coffee cup or is sick and is drinking out of a glass, they can leave some virus behind. And the question is, we don't really know how long it can survive. There is some research on coronaviruses, and if we look at SARS, the survivability on some types of surfaces, like plastic surfaces, could be up to as long as 9 days. I think more likely it's at the shorter end of that spectrum, by 1 to 2 to 3 days. But right now, if we want to be conservative, we could say there's a possibility that there could be survivability up to 9 days on some types of surfaces. The good news, however, is that regular sanitizers like bleach and alcohol and quaternary ammonias, things like that we typically use and that we know how to use, are quite effective in terms of cleaning and sanitizing. So some of the things that we're going to just touch on today, as I mentioned before, we have a resource page set up on our website that you'll be able to go and get more of this information, and we'll be delving into more detail on some of those web posts in coming days as well. I think we want to get this information out, especially as it relates to the food industry, because the food industry is really a critical portion of our supply chain. And we want to make sure that people have good information and understand the science, and also understand the risks associated with this outbreak, but also understand what they can do to be prepared in responding to the outbreak. Because one of the concerns is that disruptions in the supply chain, certainly pharmaceuticals and medical supplies are critically important in terms of treating people that may become ill, but the food supply is also a very important component of our daily life here in the United States. And if we do see more widespread illness, it will become imperative that we can manage the illness within a community and still maintain some of the critical functions that are part of our infrastructure, and that certainly includes the food supply, food manufacturing, and transportation. So part of the important piece of this conversation is understanding, who you receive your raw materials from. You've probably already thought about this, but who am I getting those raw materials from? Do they have plans in place to continue to operate if something happens? Or may they not be able to supply you with a critical ingredient? And do you have alternate suppliers in different regions of the country or different regions of the world that you can look at to source from? And food safety is still important as we go through a situation like this. Have you done the due diligence that you need? If you need to switch suppliers quickly, do you know what those critical questions are to ask in terms of risk? If you're receiving an ingredient that, let's say, requires a preventive control. So thinking about those things now and having those conversations now is going to be of critical importance if we do start to see any potential disruption in the supply chain. And when I was putting this presentation together last week, we were more focused on China and Asia. Obviously, we've seen that that's no longer the case. And so also monitoring where cases are worldwide and how that may impact your supply chain is going to be important. And we'll have good resources in terms of where you can look and find that on our website as well. Again, this is very similar to influenza. So what do we know about preventing influenza or the spread of influenza? We know that good hand washing and hand hygiene is important. And so really emphasizing those things in your food manufacturing facilities or in a restaurant setting is going to become even more critically important. Making sure that people are doing that after they change taps or potentially touch their face or anything that would potentially pass or transmit something like the virus. Hand washing is really going to help minimize the risk of that spread within a facility or within a restaurant setting. Also critically important is having, looking at your employee illness reporting system. What does that look like? Do people understand what symptoms they should be looking for? And have you communicated to them, that they shouldn't come to work if they aren't feeling well or if they have symptoms that are consistent with coronavirus? And we talked about those a little bit earlier in the presentation. If somebody starts to feel sick at work, do you have a place where they can go and be sort of isolated from other people before they can get themselves home or get themselves to a medical facility for treatment if that's what's needed? And then, what are your cleaning and sanitizing protocols if you do have somebody that becomes ill at work? And again, we can use the standard sanitizers. There's pretty good evidence that if you did have an employee that, say, started feeling ill while they were at work, if you wanted to clean and sanitize their work area, the spot they were in, using a bleach solution or an alcohol wipe down, that should be sufficient in terms of killing the virus. There isn't an indication that widespread decontamination would be needed if it's a limited exposure within a setting like that. And some of those recommendations are coming out of, from CDC, out of the kind of maritime and cruise ship industry as well. So we've been following that information as a fairly good surrogate for some things that we might see in a more of a food processing environment. It's on here to encourage your employees to get the flu vaccine, not because the flu vaccine is going to be protective against coronavirus, it's a different virus, but it's a way to help maintain a healthy workforce. And it's also a way to potentially decrease the stress on the medical system. So the more people that can get vaccinated against the flu, which is obviously at this point more endemic in the United States or more widespread in the United States than coronavirus is, the better off we all are. So if you have employees that haven't received the flu vaccine, that's some information that you can pass along and really encourage them to think about doing that. Workforce planning is going to be important. If we see increased rates of absenteeism within the workforce, how do you address that? Do you have people that are cross-trained? Do you have people in non-operational roles that can assume those operational roles if need be? It's possible if we see community-wide transmission that absentee rates may get to the point where they really do affect or impact day-to-day operations. And so thinking about what are those key critical functions within your process, and do you have depth in those roles so that you could continue to operate if need be. Another piece is reaching out to the local and state health department, and I would encourage everybody to do that now, to try to identify who you should reach out to wherever you are, if that's a locality or a state, depending on the public health system where your facility is located or where you have facilities. Reach out now and have those conversations and say, you know what, if we were to identify a case of coronavirus in our workforce, who should we talk to? What should we do? And I think that's going to prompt local and state health departments to make sure that they're thinking about the food industry as well, because again, we play a very important role in the supply chain. This is really just kind of a summary of what I've already addressed here. Supply chain impacts, you know, we talked about the survivability on fomite surfaces being about up to 9 days, probably not that long. So anything that's been in transit and that hasn't been in contact with anyone for that time period should be fine. You know, so if something's been in a container ship moving across the Pacific Ocean, you know, that trip takes upwards of 20 days or more. Those packages are going to be fine. Those materials that you receive should be fine just by virtue of the fact that the virus can't survive that long. Where that may become more difficult and where we may want to start to monitor some of those supply chain impacts is, you know, if we do start to see more widespread community transmission in the US, and then I think, you know, that's an area where we'll have regular updates on our website in terms of recommendations and potential need for cleaning and sanitizing on incoming shipments, if that's in fact warranted. And we've already talked about kind of, you know, reaching out to your suppliers to understand what they're doing to prepare and, you know, identifying alternate suppliers for those key ingredients that you may have. So what are some of the impacts, you know, global supply chain? We're seeing that now. Obviously, there's disruptions in the global supply chain, and those are going to be, at some points in time, hard to predict and frankly hard to manage. And so the more you can find depth and alternate suppliers while still maintaining, you know, kind of those key food safety programs as you look at onboarding suppliers, that's going to be important. And that's really work that can be done now before we're seeing any real widespread illness in the US. We're also seeing that, you know, public health surveillance systems in other countries, you know, outside of countries like China, the United States, and Europe, they may not have the kind of public health surveillance systems that we're familiar with in the US. And so therefore the number of cases that are occurring in those countries may be much greater than what's being reported or detected right now. And so that's a piece that we're going to have to keep an eye on and keep a handle on, and especially something to think about if you source ingredients from some parts of the world that may not have that same public health infrastructure as we do in the United States, Europe, or China. I think it is important to state that the risk of transmission of the virus from food or ingredients in the supply chain remains very low. It's more of a person-to-person risk. You know, that's not to say that if somebody in a restaurant setting was sick and they coughed on food right before it was served, in that kind of context, it's possible that, you know, somebody consuming that food could become ill. But in general, we don't think about this right now in terms of the way that we think about E. coli or salmonella or some of these microbial contaminants as being foodborne pathogens. This isn't really a foodborne pathogen. It's much more like influenza. And so employee health and hygiene is critical in terms of controlling spread. We've talked about hand washing. You know, again, an important piece that we haven't mentioned is that sanitizers, you know, 60, 70, or 60%, really effective range is kind of 60 to 90% in terms of alcohol overall, but the hand sanitizers are very effective in controlling and killing the virus on hand. That's another important piece. Obviously, you know, making sure that you have soap, water, and all the appropriate facilities for hand washing in your facility is going to be key to protecting your workforce and minimizing the risk of transmission. Again, you know, don't work while ill and have that employee illness reporting policy in place. And I think it's really important to emphasize that. That's going to be critical over the next, coming days, weeks, and months here as the outbreak continues to evolve. Here's some specific, cutoffs in terms of fever. Employees, really CDC's cutoff is 100.4. That's really the definition of a fever. And if people are experiencing any of these acute respiratory symptoms, they should not be working and should not be coming to work. I think this is an important piece on face masks. CDC doesn't recommend that healthy people wear face masks, and we don't see a lot of that in the United States. It's not culturally something that we're used to. There's very limited evidence that those are effective. So like in this picture here, those would be considered surgical masks. They don't form a tight fit around the face, and they're just simply not effective in terms of protecting the wearer against contracting something like coronavirus or even influenza for that matter. There is evidence that wearing something like a surgical mask if somebody is sick can help prevent the spread of illness, but that should be reserved for healthcare settings where people are going to the doctor and sitting in waiting rooms and those kind of settings. Just another piece on the face mask piece, you've probably heard about N95 masks, which are really called respirators. Those are effective in protecting against contracting viruses like coronavirus or influenza, but those need to be fit tested. So they actually need to be fitted to an individual's face to make sure that there's a good seal. And those really at this point need to be reserved for the healthcare setting, for clinical settings and hospital settings, because we're already seeing a worldwide shortage of those kind of masks, and they're going to be in short supply and very difficult to obtain anyways. And I will say that you can go online and probably find some for sale at probably 10 or 15 times what they would normally cost. It's unfortunate that we're seeing people taking advantage of situations like this, but that is the case. These are good resources to find the local health officials, either at the state or local level. You need to reach out and figure out who you should be reaching out to and contacting. Again, we've talked about the importance of getting the flu vaccine. These are effective sanitizers. So we mentioned ethanol, hydrogen peroxide, and bleach. Very effective in terms of cleaning surfaces and disinfecting from the virus should it be spread. All right, Brian, I made it through as quickly as I could.
That was the most important thing. Thank you, Ben. I think the goal today was to make sure and get this information out. A number of you have asked if we're sharing this. We certainly will. We'll get this back out as soon as we can with the link, as well as the link to your resource page. I'm going to try and find that and get that up here now. You can see that highlighted on this resource slide. So that's the atchinsongroup.com/COVID-19. I think, as you noted, this is so fluid, it's changing so quickly. So it's important that you're getting up-to-date information, that you're reaching out to those public health officials in your areas. We really appreciate how difficult of a time this can be, and all the hard work you're all putting in, and grateful that you're making a few minutes to get up to speed as best as we can help today. Do have a lot of questions here. We're not going to get to all of them. I think we've got over 400 people on here. So Ben, a couple quick ones, and then, as I noted, we'll take these offline. We also have our LinkedIn group for FISMA Fridays, and we'll try and get key links and the replay and some information up there as well. So we'll try and arm you with as much as we can. Ben, you mentioned a few times the phrase community transmission. Can you just define what that means and how it's different?
Yeah, sorry to jump right into the jargon there. So community transmission would be transmission from person to person within the United States or within a community. The cases that we had seen prior to California all had a travel connection to a country where illness was spreading, the majority to China. So when you start to see transmission within the community, it suggests that the virus is in the community and circulating. So that's the definition there.
Got it. Thank you. You touched briefly, which I think everybody's keenly sensitive to right now, is can it transmit through food? I think you touched on that. Would the same answer apply to kind of packaging or anything else? Is it safe to assume the same risk level there?
Yeah, the risk, again, is going to be very low if you're handling a
Yeah.
package, even if somebody sneezed on it, unless it was immediately, within, several hours of that happening, the risk itself is going to be pretty low. And in those instances, somebody would have to touch it, immediately rub their eye and things like that. So that, again, we talk about survivability. We're learning about how long this can survive on
Sure.
surfaces. And so, that's why the hand hygiene piece is so critically important. So as companies look at receiving materials, and again, if we start to see more widespread transmission in the US, that hand washing piece becomes even more important. Or, thinking about receiving things, wearing gloves and things, making sure that you have the appropriate personal protective equipment. And we'll have information on that on our website as well.
Great.
A lot of the, I think one important point is to, I know there's a lot of misinformation out there right now, probably so, circulating on social media. If people want good information, certainly come to our website, because we're going to put that in the context of what's important to the food industry. But websites like the Center for Disease Control and the WHO, the World Health Organization, those are the kind of resources that people should be looking at. So whatever you see on social media, certainly take with a grain of salt. Go to trusted sources to get information, because unfortunately, people take advantage of people's fears in situations like this.
Yeah.
And good information and arming yourself with good information is one of the most important things that you can do.
Yep, absolutely. Yeah, and we're seeing a lot of those questions. I've read this or heard that, and so that's part of our goal here, is just to provide you a trusted resource. A lot of these are just more general about the virus, and I'm going to try and keep the few that we do get to here related to the food and beverage industry. There was a question about regarding FISMA or Foreign Supplier Verification Program. Is there any recommendation in terms of procedural, should they send a letter to their suppliers confirming how they're preparing this, or is there any recommendations at this stage on how they should handle that, or if they need to?
I think if you're sourcing ingredients or materials from an area where we're seeing widespread transmission, so primarily that's Europe and Asia right now, or at least that we know of, that's a fair question to ask of your supplier in that area. Sort of what control measures are they putting in place to ensure that they're minimizing the risk of contamination of their product. Now, that said, again, it's important to remember that the survivability of this virus coming from products overseas is going to be very low or non-existent, because it won't survive long enough to essentially make the trip. So right now, the risk associated with contamination of products coming from overseas is not going to be significant. It's more the disruption in the supply chain that I think people should be thinking about.
Okay. One additional question on that. So there's questions about survivability as it regards with regards to heat or frozen food. Is there? I'll just leave it there. Can you speak to that real quick? Does that help or hurt or change it in any way in terms of survivability?
Yeah, that's a good question. The literature doesn't address that currently, although what we do know is, heat is going to denature a virus, although I can't quote an exact temperature in Celsius or Fahrenheit at this point. There's nothing that I've found that suggests that freezing is going to, kill the virus one way or the other. So there's nothing in the literature that speaks to that right now. And hopefully we'll be able to find something and provide more information along that. But we've certainly been looking and keeping abreast of what's available. And we're going to, peer-reviewed literature when we're looking at this information. That's where we're getting and sharing a lot of our information, as well as, these national and international health organizations.
Sure. I think this is an important question. This came in, which was, could state or local public health shut down companies if this, perpetuates, or is this something that companies would decide on their own? I guess it's unique. It's not foodborne, but big part of the supply chain. Any thoughts on that, or?
Yeah. So those state and local public health departments have the authority to, instill control measures similar to that. We haven't seen that done certainly in the United States in a long time.
Right.
And I think that the evidence is that if the state or local health department asks somebody to voluntarily close, that tends to be a lot more effective. Companies may look at a situation and decide that, at least for a short time, that may be the most advantageous approach to limiting illness within their workforce, or because illness becomes more widespread in a particular location. I think that's what a lot of people are concerned about, and I think that's where reaching out and having some of those conversations with your state or local health department is going to be important, is to understand who should I talk to, establish that relationship ahead of time. What are some of the potential outcomes? Again, I will go back to, everybody on the phone plays a very important part in the U.S. supply chain or global supply chain in terms of making sure that food is created and that it can move through and that people get access to the food that we need, even in outbreak settings like this. So taking good information and being as prepared as possible is, I think, a great responsibility, and it's something that we want to help companies think about, using whatever information is at hand.
Right. Okay. Well, thank you. I think with that, we're going to let you go. We know you're a very busy, in-demand person right now. Really appreciate you pulling all this together. We know that it's changing. We hope everybody, again, keeps that in mind. This is what we know right now, and it's going to change. So again, the website address is atchisongroup.com/COVID-19. We'll include that link in our follow-up with a link to this recording along with the slides, and do our best to answer any other questions we didn't get to offline. We know there's a lot of questions. We know there's a lot of things we don't know yet. But Ben, I think you did a wonderful job bringing us up to speed as best you can. So really appreciate you being here and being a great resource for all of us.
Absolutely. Yeah. Thank you. And if you have, check our website. And if you have questions, you can also reach out to us at the Atchison Group as well. So thank you.
Will do. And thank all of you for your hard work. And again, we'll get this information out to help you as best we can. We appreciate you. And hopefully we'll see all of you next month. Take care.